A Tucson surgeon hit with a wrongful death verdict is once again shining a spotlight on healthcare secrecy in Arizona.
Tonight, we're answering the question, who's responsible for overseeing bad care? 13 News Chief Investigative Reporter Valerie Cavazos continues her series, Deadly Decisions.
We reported at least 13 patients died under Dr. Jeffrey Monash's care, all within 6 years, and 5 of those deaths within 6 months. Dr. Monash has admitted he defined surgeon burnout for years, yet he continued to perform surgeries. Dr. Monash told me he's done nothing wrong and disputes he was responsible for all but one of the deaths. We wanted to know who's overseeing all this and what's being done. In the process, we discovered the deck is seriously stacked against the public knowing about questionable doctors.
The Arizona Medical Board is the state's watchdog of physicians, the protector of patients. It primarily relies on public complaints to launch investigations. Dr. Barry Weiss is a professor in the U of A College of Medicine who served on the Arizona Medical Board in the 90s.
The board can't take action about things they never heard of. Somebody has to report it, and then they will investigate it.
These two attorneys, Michael McNamara and Amy Hernandez, filed complaints after 2 of Dr. Monash's patients died in 2020. Both raised red flags, alleging serious mental impairment from chronic drug use and severe insomnia that they say cost more than a dozen patients their lives.
They've had all that information since early 2020.
Both attorneys asked the board to investigate. Both argued Dr. Monash's license should be suspended. On average, it takes less than a year to complete a case. But McNamara says more than 5 years later, his complaint is still an open investigation with no end in sight.
Kind of strange. That was not my experience on the board. If it's taking years to evaluate a case, that puts the public at risk because a doctor who may be practicing inappropriately, nobody might know it for a couple of years.
What about Hernandez's complaint? Earlier this year, the Arizona Medical Board reprimanded Dr. Monash, saying he provided substandard care.
Is not meeting the standard of care.
He's appealing it, so that means the disciplinary action will not be made public until it's resolved.
I asked the Arizona Medical Board for an on-camera interview. I was told by law they cannot grant that because of privacy restrictions and would only answer general questions through email. This means I can't get answers on specific doctors or cases.
Board leadership explained in this email, in general, some cases take longer to investigate because of their complexities, legal delays, and staff turnover of longtime investigators. To put their caseload into perspective, there were 25,000 licensed MDs in Arizona in 2019. The board received about 1,200 complaints. But as we discovered, these complaints are not made public.
Unless there's been a formal discipline that becomes public, the patients don't stand a chance of finding out.
There have been 5 other complaints against Dr. Monash since 2009, all dismissed. Hernandez filed one of them in 2016 after the death of one of his patients. The family sued, and the case ended in a settlement. Dr. Monash admitted negligence then, and also recently to me.
There was one patient, Michelle Halderman, that you mentioned, that I did think I made an error on. And I didn't argue it. And you know what? I'm human.
So it came as a shock to Hernandez when the board dismissed her complaint, no details given.
If their duty is to protect the public, and this doctor has said I was negligent and made a mistake in this case, why then, there seems to be no reason that I can come up with that they would then dismiss it.
It's in those years surrounding the 2016 death that's important. Coming up at 10, we examine what happened and why the deck is stacked against the public knowing about medical mistakes. Valerie Cavazos, 13 Investigates.